Sydney. We're going to do a head-to-toe assessment. It takes about an hour. Do you need to go to the bathroom before we start?
No.
Okay, what's your name?
JP.
Okay, and can you tell me what year it is?
2025.
Okay, can you tell me where we are?
The hospital.
Okay. So I saw JP walk into the exam room and his gait was smooth and steady. His body structure is normal. He's sitting upright. He is alert and oriented, times, person, place, and time. His behavior is appropriate to the situation. He appears well groomed. His appearance is normal as expected. JP, can you tell me what you would do if you saw a house on fire?
I would call the fire department.
Okay. And your judgment is intact as well, and speech is clear and articulate. I would get a set of vital signs at this time. I would get pulse, blood pressure, respiratory rate, and temperature. So I'm going to start with your head. So your head is midline to your body. There's no gross deformities. I'm going to be touching your head, okay?
Okay.
Any tenderness?
No.
Okay. Your skull is well formed. Your hair is evenly distributed. It's clean. There's no infestations. I'm going to go ahead and palpate your sinuses. So tell me if you have any tenderness of your frontal
No tenderness.
and maxillary.
No tenderness.
Okay. Looking at your eyes, your sclera is white and there's no blood vessels. I'm going to pull down your eyelids, okay? And your conjunctiva is pink and moist. Your eyelids, the skin is clean, dry, intact. They cover your eyes completely when you close your eyes. Your eyelashes are evenly dispersed. They curl up and outwards. I'm going to look at your pupils. They're round bilaterally. They're both about 4 millimeters bilaterally. I'm going to shine this light in your eye, and you can just look behind me, okay? I'm going to check your direct and consensual light reflexes. Okay, and then can you look at my finger, and then can you look at the wall behind me, and then back at my finger? Okay, so your eyes are perilla, they accommodate, and both the direct and consensual light reflexes are intact. I'm going to use this ophthalmoscope to look at your red light reflex, so using my right eye to look at your right eye. Okay. So your red light reflex is present in both eyes. Here's the Rosenbaum chart.
Sure.
Okay. I'm going to have you hold this about 12 to 14 inches from your face, and can you cover your left eye and read the lowest line that you can?
EDSCZP.
Okay, and then can you cover your other eye and do the same?
EDFCZP.
Alright, and then with both eyes.
EDFCZP.
Okay. So the left eye, the right eye, and both eyes are 20/20 vision. Okay. Your nose is midline on your face. There's no deformities. The skin is clean, dry, intact. I'm going to have you lean back, and I'm going to use the pen light and look in your nose. And there are fine hairs present. The mucosa is pink and moist. The turbinates are pink and moist, and your septum is pink and moist and midline. And there's no deviations with your septum either. I'm going to look at your mouth. So your lips, they're pink and moist. There's no lesions or wounds. Can you open your mouth and say ah? Okay. So the uvula rises and falls when you say ah. Your gums, your mucosal membranes, your hard and soft palates, your posterior oral pharynx are all pink, moist. Your tongue is pink and moist. It's rough, and your teeth are white, and there's no missing teeth, and they're in line. I'm going to move on to your ears, so I'm going to palpate both of your ears. Tell me if there's any tenderness. I'm going to palpate the pinna and the tragus and the mastoid. Any tenderness? No. Okay, let's do the whisper test. I'm going to have you cover your right ear first, and I'm going to say 3 words and you repeat them back to me. Shoes, computer, curtain.
Shoes, computer, curtain. purple, orange, green.
Okay, whisper test is passed bilaterally. I'm gonna use the otoscope and look in your ears. I'm gonna pull the pinna up and back, and I'm gonna angle the otoscope towards your nose. Okay, the middle ear is pink and moist. There's fine hairs and a small amount of cerumen present, and the tympanic membrane is pearly gray. The cone of light is present, and the light reflex is present. Do the same thing over here, up and back, and angle this towards your nose. Okay, same thing, the middle ear canal was pink and moist. There's fine hairs present, there's minimal cerumen present, and the tympanic membrane is pearly gray with the cone of light present, and no perforations. Okay. I think that's for your face. Okay, I'm gonna palpate your trachea. Can you look up? Trachea is midline, no deviations. I'm gonna give you a sip of water, and I'm gonna palpate your thyroid. When you swallow, we'll go ahead and swallow. Okay, the thyroid is palpable, no deformities, no masses. I'm gonna palpate your carotid artery on one side at a time. 2+ regular rhythm. 2+ regular rhythm, and I'm gonna listen with the bell of my stethoscope for any bruits. Okay, no bruits on either carotid present. I'm gonna palpate your lymph nodes of your head and then of your upper extremities at the same time, okay? Let me know if there's any tenderness.
Okay.
Preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical, deep cervical chain. I'm gonna do those over here as well. Posterior cervical, superficial cervical, deep cervical chain, and then supraclavicular. If you could hunch your shoulders, perfect. Okay, and then doing your upper extremities, can you hold your arm out? So central, lateral, pectoral, subscapular, and infraclavicular. And then same thing over here. Central, lateral, pectoral, subscapular, and then infraclavicular. Any tenderness of any of those?
No
Okay.
pain and tenderness.
And none of the lymph nodes were palpable or inflamed. Okay, I'm gonna do your upper extremities. So looking at your arms, your skin is clean, dry, it's warm and intact throughout both upper extremities. There's no wounds or lesions. I'm gonna palpate both of your brachial pulses, which is a 2+ regular rhythm, and both of your radial pulses. It's a 2+ regular rhythm. Can I see your fingers? Your capillary refill is less than 3 seconds bilaterally, and your nail angle is about 160 degrees. There's no clubbing. Okay. I'm gonna have you lay down, if you would. Oh no, wait, I'm sorry. Can you sit back on the edge of the bed? I'm gonna do your back first.
Okay.
So your AP diameter is about 2 to 1. And I'm gonna put my hands on your back, and can you take a deep breath in? Okay, so you have an even expansion. Your workup breathing is unlabored. It's a regular breathing rate. There's no use of abdominal or accessory muscles. I'm gonna go ahead and check CVA tenderness, so I'm gonna put my hand on your back and punch my hand and let me know if there's any pain.
No pain. No pain.
Okay. And then I'm gonna percuss in 10 areas back here, so you can just breathe normally. Okay, so all areas sounded resonant. There was no dullness, and now I'm gonna auscultate in those same 10 areas. If you could just mouth every time you feel my stethoscope move. Okay, so all lung sounds were clear. Also of note, your skin is clean, dry, intact, it's warm, there's no wounds back here as well, and your spinous process is midline, there's no curvatures of your spine, and the spinous muscles are well formed. I think that's it for your back. So I'm gonna have you lay down. And I'm gonna untie your gown. Sorry. Just, okay. So the skin on your chest is also clean, dry, intact, and warm throughout. I'm gonna auscultate in 8 areas, and so you can again just take a deep breath through your mouth. All lung sounds were clear on the anterior chest. And once again, your work of breathing is normal. There's no use of abdominal or accessory muscles. I'm going to move on to your cardiac assessment. So I'm going to palpate for the PMI at your 5th intercostal space mid-clavicular line. I don't see any lifts or heaves, and then I don't feel any thrills either. I'm going to listen with the diaphragm of my stethoscope first, so I'm going to go down the 5 points. I'm going to listen for a full minute and get your apical pulse, and then go back up with the bell to listen for any murmurs, okay? Okay, so the first area would be right sternal border, 2nd intercostal space, which is your aortic. The second spot would be left sternal border, 2nd intercostal space, which is pulmonic. The 3rd place would be Erb's point, which is the left sternal border, 3rd intercostal space. The 4th would be left sternal border, 4th intercostal space, which is your tricuspid valve. And then your mitral would be 5th intercostal space, mid-clavicular line. So your apical pulse was 80 beats per minute with a regular rhythm, and 5 areas as well. Okay, I'm gonna move on to your abdominal assessment. So you can raise your gown up from the bottom. Okay. So your skin on your abdomen is clean, dry, it's warm. Sorry. And intact. My hands are so cold. So I'm first gonna auscultate in all 4 quadrants for vowel sounds. Okay, vowel sounds are normal active, and can you slightly flex your knees also just a little bit? Okay. I'm gonna percuss all 4 areas of your abdomen now. Okay, so all 4 areas sound resonant or tympanic. There was no dullness. I'm gonna palpate your abdomen first lightly for any tenderness, okay? So, any tenderness. Okay, and then now we're gonna do deep palpation, which is feeling for any masses or tumors. Okay, didn't feel anything abnormal with deep palpation. I'm gonna try to palpate the liver borders, so can you take a deep breath in and then exhale? Okay, liver border was not palpable. We're gonna check for rebound tenderness, so I'm just gonna push in on your right side. And any tenderness with that? Okay, no rebound tenderness. I don't see any, I do say aortic pulsation. I don't see any other abnormal pulsations. I'm gonna listen with the bell for any, there's no hernias since you lifted up your head.
Oh, I thought you said pulsation.
Well, it's just your aorta. Yeah,
Oh.
I can see it right there. I'm gonna listen with the bell for any bruits at the aorta, the 2 renal arteries, and at the femoral arteries. Okay, no bruits at the renal, aortic, or femoral arteries, and then I'm gonna palpate your femoral artery for rate and rhythm. So regular rhythm 2+, bilaterally. Okay, I believe that's it for your abdomen. And then looking at your lower extremities, your skin is warm and clean, dry, intact throughout. There's no wounds or lesions. I'm going to check your posterior tibial pulses, which are 2+ and regular bilaterally, and then your dorsalis pedis pulses are 2+ with a regular rhythm bilaterally. Your capillary refill is less than 3 seconds bilaterally, and there's no clubbing. The nail angle is about 160 degrees. We would need to educate about a breast exam and a testicular exam, so I would tell the client they need to perform a testicular exam once a month. After the shower, in the mirror, anytime during the month. They need to inspect the penis and scrotum for hair distribution, any masses, deformities. You would look at the urethral meatus for location and discharge, and then you would need to palpate the penis, the testes, vas deferens, and epididymis for any pain or tenderness. And then if my patient was a female, we would do a breast exam and educate about doing a breast exam at home. So at home, the patient needs to stand with their arms at their side, their arms on their hips, and then their arms over their head to bring out any dimpling. It should be done after, in the shower and in the mirror after their period, once a month. They need to palpate all 4 quadrants, starting at the nipple and then moving out to the tail of Spence for any lumps or tenderness. And then if we were doing one here, I would have the patient lay with their arm above their head and a pillow behind their scapula. And we would palpate all 4 quadrants just like they would do at home. I'm gonna look at my sheet really quick to see if I missed anything. Okay, the only thing I'll add is that the abdominal contour was flat and there's no JVD present, and your skin turgor is normal, there's no tenting, so